But for me, it all started one day. I was walking down the hall at work, and I got a little tunnel vision, felt a little funny, and that's weird. Went to a walk-in clinic, they did some measurements, refunded my money and kicked me out, and said go someplace with an EKG. From my viewpoint, if a walk-in clinic refunds your money and kicks you out, just go to the hospital. That's what I did. So I go to the hospital, I park, and I walk in, and I'm thinking, man, I don't want to be here this long, and I'm like, you know, the only thing that's really happening is I feel this little tingle here. It's sort of like a sip of soda. And, you know, I had that little vision thing, and, well, yeah, chest pain. There we go, got that. Is that arm hurting? Well, I did that extra. Yeah, that arm's hurting, sure, whatever. So I kind of exaggerated my symptoms a little because I didn't want to sit there too long. And I sat down, and boom, I'm in. And the phone rings, and I called my wife and told her that, yeah, I'm going to the hospital. They kicked me out and refunded my money. And the lady's sitting there taking my blood pressure, which is kind of weird. There wasn't much difference between the two. The heart rate was about 136. It's kind of weird. And the lady's on the phone, yes, Scott, no, he's here. Yeah, I'm taking care of him. Okay, I know he's a friend of yours. Okay, thank you. And that was my friend who was a nurse there, and he says, you know, he's not crazy, he's not a hypochondriac, you know, take him seriously. So at that point, I'm just wanting to get in and out. So they say, okay, come with us here, put this little gown on and go to the bathroom. And I go, can I use the bathroom? They go, be quick. So I put the little gown on and I lay down, and I'm laying in the hallway looking at the ceiling going, you know, I'll bet I could sell murals. This is really boring. And about that time, the lady walks up. So, Mr. Grant, how are you? I said, I'm fine. I got a little tangle right here. She reaches over, ching, ching, and takes off running, literally knocking things out of the way, slamming me into a room that is now known as the infamous bed 10. So 5 people suddenly descend on me. There's one person, Mr. Grant, I'm taking blood. Mr. Grant, I'm putting in an IV. Mr. Grant. And they're all standing there. I'm like, that's kind of weird. Okay, whatever. And then the alarms start going off, and I look up, and my heart rate's going from 120 to 220, and I'm like, that's interesting. And they're doing all this stuff, and the doctor orders up a huge dose of lidocaine. And it was really weird because suddenly I realized that I was thinking through a fog. And my brain cleared, and I went, wow, what was that? And he tells me, 10 cc's of lidocaine or something like that. Well, oddly enough, I just don't pass out when my blood does bad things. I just hang in there. So I'm sitting there joking with them because, well, I got nothing better to do. And we're cracking jokes back and forth. And my wife finally shows up, and by then the alarms have quit going off. And I'm sitting there, and it's kind of funny because she sits down, and I'm like, hey, kiss me. So she reaches over and goes, it goes beep, 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 beep. Oh, that's cool, that's neat. So I said, hey, kiss me again. She goes, it goes beep, 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 beep. I said, oh, that's really cool. Kiss me a little longer. It goes beep, beep. She goes, what are you doing? I go, look, you excite me. See, I got proof. She goes, I'm not kissing you anymore. And that's kind of started my whole introduction to this. And sometimes when talking to Candace, I feel a little bit guilty. We have the same disease. My road has been primo easy, comparatively speaking. I got absolutely lucky. I presented with ventricular tachycardia that didn't kill me, and that's not often you have that opportunity. And then I had this little Indian doctor come in, and he's kind of a funny little guy. He has this one coat on his shoulder, and he sweeps in magically with this coat flying behind him, and I think he glued it on. I really do. But he comes in and he asks me a few questions. Do you drink? And I'm like, well, yeah. He goes, well, how much do you drink? I go, well, I have a margarita on Wednesday and a sake on Thursday. He's like, argh. He goes, there, I want to do a heart biopsy, and then we'll see how that works out. I think maybe we'll do electrophysiology. And this little guy, he was just like on top of it. I don't think he had any fear of lawyers whatsoever. To this day, he can't explain to me adequately why he did a heart biopsy. I remember him telling me this. He goes, yeah. He goes, you know, we don't really know what's going on, and it's your heart, and, well, if we take a piece of it and look at it, and he just didn't know what else to do, the truth be known. Fortunately, that went to Stanford, came back, and that's how I got hooked up with Dr. Cooper. But I found out a few interesting things about the medical profession along the way. And oddly enough, I have been forward-looking throughout all this mess, in my opinion. Because they dropped the defibrillator in a few days later, and that's my second birthday now, I call it. Because I had a life, and I kind of died, sort of, and now I have this new life that I really kind of enjoy. And that's how I've sort of got through all of this mess, if you want to say getting through. I just never really took it that seriously. Okay, fine, whatever, we're going down the road. And I've had some real fun with doctors, just to make it a little more fun here. I look at every opportunity. I look at Candace a lot because she's going to understand some of this fun stuff. Doctors, no offense to you, lovely doctors, as I was telling you earlier, are really very practiced giving us bad news. Really, really good at it. But you do it at some odd times. Okay, I'm laying there, I've just had an angiogram, I'm like drunk, and this doctor's leaning over here. Well, Mr. Grant, your heart function is 20%, and you have myocarditis, and this is a serious illness, and the survival rate beyond 5 years, and you may need a heart. I'm like, okay, look, I'm still drunk. What are you doing? And he goes, do you understand all this? I look up at him, and I go, yeah, I'm screwed. He looks down and goes, well, that's one way of putting it. And then I had the good fortune of the company I worked for. I didn't realize it, but our CEO was actually chairman of the board of the hospital. So I got a little extra treatment there. I asked for a second opinion, and the head of the whole cardiac program for Holmes Regional Medical System shows up in my room. And he's doing the, okay, he's trying to be serious, but he's got me, what do you know? And so he goes, okay, have you been out of the country? No. Do you work with heavy metals? No. Do you, no. He's like, that's interesting. And again, I looked at him and he goes, well, what do you think? I go, I think I'm screwed. He goes, well, 5 years ago you would have been for sure, but now, maybe not, because they dropped the defibrillator in and whisked me out. Then we get the phone call. My lovely Indian doctor, who I get a kick out of him. He calls and he leaves this message. Would you leave this message? Mr. Grant, you and your wife need to be in my office at 8 a.m. in the morning, first thing. Like, okay, great, now what? So we show up, and the biopsy came back from Stanford. And a lot of lucky things happened there in that most times, as you mentioned, a biopsy is not something they want to do. Because I start out with a heart, and I stretch it out like a balloon. The walls get pretty thin, and now I want to take this little instrument called a biotone that kind of looks like the little alien monster chomping on your heart, and you want to run it up the veins, slam it into the wall of the heart, but not go through it, pull out a few pieces, and hope you get a piece that tells you something. Well, he did that, came back, and they told me to contact Dr. Leslie Cooper at the Mayo Clinic, gave me a phone number. Well, I had two surprises. First of all, I dialed the number. This is Les Cooper, and okay, well, she's a man. That's interesting. That was my first reaction. And then we went and got a pizza, and after that, he called. And this is my first interaction with him. And as you pointed out, he's like, recognized in this small community of myocarditis people. He talks to me for half an hour on the phone explaining this stuff to me. And my options are basically conventional treatment, no treatment. They said 3 to 6 months. With treatment, 6 to 12 months, you'll need a heart transplant. And there's this guy, Cooper, he's got some kind of weird experiment going. You might try that. So I talked to him, and he said, well, we have a study. It's 2 phases. We have a blinds part, and we have an open part. And if you're in the blind part, you don't know what treatment you get. It could be the one we know that doesn't work. Or it could be the one that, well, we don't know if it works. I decided to go with the one that we don't know if it works. And that was like 2000, so I've been kicking around ever since then. And some of the things I have found when I started this, I looked on the internet. Well, if you search for giant cell myocarditis, this is even after you get a diagnosis. At the time, all I found was a few obscure autopsy reports. That was it. And then I said, well, this is kind of weird. I wonder who else has got this thing going on. Well, I'm an engineer. I'm out of work. I'm kind of bored. So I said, I want to make a website just for the heck of it. So I made a website. And there I basically wanted to gather some information. Dr. Cooper gave me some information, and I just tried to combine what I could into a site. And I spent $75 on a message board, threw that in there so people could just converse. And I said, hey, here's my email address, contact me. Well, at first it was actually really depressing because I heard from family members for a while back and forth, but his young son had died. And he was, I almost want to use the word grief-stricken to the point of obsession about why his son had died and why he couldn't protect his son from this disease. And his son had been diagnosed with giant cell after the fact. Well, working with Dr. Cooper, I tried to get some information out there and found out some interesting things about it. The most common diagnosis of giant cell myocarditis is at autopsy. The most common symptom of giant cell myocarditis, death. So these are really kind of hard diseases to treat. And even once you know you have it, it's not clear what to happen. A lot of people, and at one point Dr. Cooper kindly informed me that he didn't want to appear if I was trolling for patients, I think he kind of indicated. Because what would happen, I would get people that would contact me and they're like, you know, my son's been diagnosed with giant cell myocarditis and I'm in such and such place. And I'm like, well, have your doctors contacted Dr. Leslie Cooper at the Mayo Clinic? No. I'm like, okay, how can they not know this? So I'd say, well, I recommend they contact him. And sometimes I would contact him and say, hey, they would like to talk to you, is it okay? And he never refused once, always boom, 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 there. And even then, people who were diagnosed, I only know of one person that I contacted through the website, and it was a young girl, like 16, she survived. But that's the only one I've heard about through the website, other than Candace, of course, with a heart transplant, that actually survived. And along the way, I've tried to have some fun with doctors. Doctors are lots of fun. I love you guys because you don't expect some things, and I'm the kind of guy that has fun with you. Turns out the drug Versed, real quick. The drug Versed is supposed to put you out, and it's supposed to make you not remember. Well, it doesn't work very well for me. I always wake up and I always remember. And my favorite experience was at the Mayo Clinic when I had to have a pacemaker explanted and moved to the other side. I'm laying there and the young plastic surgery resident is doing his stitching up. And boom, eyes pop open. I see his face, I see his eyes. I go, oh, hi, Doc. How did the testing of the defibrillator go? I see his pupils. They just start blowing out. They're getting big. And I realized that, okay, he hasn't finished closing me up. He's still working. And if I continue to talk to him, I'm probably going to get an ugly scar. So I roll over and I start chatting with the nurse. Well, he's sitting there now with an awake patient, a needle in his hand, and about 4 sutures that aren't in. And he's like, so finally he very tentatively puts the needle in. And I'm not anesthetized in any way, no locals, no nothing. And it feels about like a bee sting. And I thought, oh, that's not too bad, this will be fun. So I totally ignore it, and I've had enough medical pain by then, it doesn't matter. Totally ignore it, and I'm cracking jokes with the nurse. This poor resident is over there going, okay, he's not screaming. And I just totally ignored it. Now there's a poor traumatized resident out there who's going, this crazy guy. But the number one thing I've found out about all of this is that it's completely unpredictable. It's like playing the lotto. You know, everyone in the country is involved in this game, whether they know it or not. And there is no rhyme, there is no reason, there is no predictability. And as you pointed out, there is no expectation of someone to have this disease on presentation. And that's really the hardest part. And with the heart biopsies, they normally don't like to do them because they hardly ever find anything. And what they find is, well, you're going to die anyway. And unfortunately, there are treatable things now that can be discovered by a heart biopsy. I was lucky in that it was a heart biopsy by a doctor who just went against conventional wisdom and got lucky enough to get diagnosed. And that's the only reason I'm still available today. Thank you.